Welcome. Our discussion today will be about HIV and AIDS. Jasmine Davis, Wendy Deal, Donna DeVenuto, Kelly DeVore, and Christina Gebhardt are the authors of this presentation. HIV and AIDS is a virus that attacks the immune system of its host. The H stands for human, the I stands for immunodeficiency, and the V stands for virus. HIV is considered a chronic infectious disease and is also a sexually transmitted disease, or an STD. There are many ways a person can contract this virus. They include blood transfusion, needle sticks, sexual intercourse, open wounds that come in contact with other open wounds, fetal transmission, and transmission through breast milk. There are so many statistics concerning the HIV virus. As of 2013, worldwide, 35 million people have been infected by HIV. 1.1 million of those people live in the United States. Statistics also show that 1 in 5, or 18.1%, are not aware that they have the virus. Approximately 17,774 people died from AIDS in 2009. Approximately 35 million individuals worldwide as of 2013 are living with HIV. Of the 35 million, 3.2 million are children under the age of 15 years old. An estimated 2.1 million individuals worldwide became newly infected with HIV in 2013. This is including over 240,000 children under the age of 15, which most are living in sub-Saharan Africa and were infected by their HIV-positive mothers, either passed through childbirth, breastfeeding, or during the pregnancy. The majority of HIV-positive individuals live in low, middle-income countries. Sub-Saharan Africa is the most affected region. 71% of HIV-positive people live there. There are two basic ways to treat HIV, through prophylaxis or through treatment with medications. A prophylaxis treatment for children in Africa include parent and family-based interventions include groups like CHAMP SA and Let's Talk. These two programs train parents in Africa how to talk to their children about HIV. This particular form of intervention includes repetition of discussions, number of topics discussed, and the depth of the conversations. Also, referring children that may have been exposed to the virus to a public health facility for testing is used often. Preventing mother-to-child HIV transmission through the use of two medications. The first medication is called azithromycin, and the second medication is called nevirapine. There is no cure for HIV, however, there are treatments available. Antiretroviral treatments, or ART medications, are given to patients who keep the virus controlled. The medication is given as a sort of cocktail that includes 3 drugs out of the 5 classes listed on the screen. 563,000 children in Africa are receiving ART through public health. At the end of 2013, roughly 3.2 million children were living with the HIV in sub-Saharan Africa. Considering the shocking fact, developing policies to help control and reduce the number of children suffering is definitely in order. There have been many developments and programs set up to aid in this epidemic. However, one of the most important and evolving policies of the treatment of HIV is antiretroviral therapy. UNAIDS has joined forces with the World Health Organization to enforce policies on expanding the number and demographics of people that are eligible for ART treatment. UNAIDS has a beautiful vision of achieving 0 new HIV infections in all people. However, with our focus being on children, there is still unfortunately more stipulations on children receiving ART than adults. The number of children living with HIV in Africa that receive ART is significantly lower than the adults and children living in other countries who are receiving ART. Most of the guidelines are directed towards adults and not children. While this is a positive factor due to many of these adults being pregnant women who can pass the HIV virus to their babies, we still need it for the children that are currently suffering to receive treatment. That concludes our presentation. Thank you very much for listening, and if you have any questions, feel free to ask.